Hi guys, good afternoon if you are in United States of America, and good morning if you are in Philippines. Salam alaikum for my friends in Middle East such as United Arab Emirates and Saudi Arabia. It's me, Dr. Jenny, physical therapist and board certified clinical specialist in geriatrics. I'm also a certified exercise expert in aging adults and founder of the Balance and Fall support group where you will watch this. So thank you so much for watching and for our thanks God it's Thursday. Another physical therapist, educator, entrepreneur. We always highlights here every Thursday. So we have an educator and professor, and Dr. Mindy Renfro will be with us tonight. So Dr. Mindy is a physical therapist, doctor of physical therapist. She is a PhD, a master trainer. You can call her a leader. She is also a geriatric physical therapy who's teaching and a professor in Toru University in Nevada. Did I pronounce it right correctly?
Yes.
Toru in Nevada, doing research, teaching geriatrics, and the CDC in 2009, guys, she is our fall prevention expert. And in 2019, the University of South California, she was our home modification national figure. All right. So as a physical therapist, we're doing fall prevention and of course, home modification goes hand in hand. She's deeply involved in the National Council on Aging, of course, American Physical Therapy Association, geriatric workforce centers, and studied and published lots of evidence-based fall prevention programs. So she's also our editorial reviewer in our peer-reviewed in journals in geriatrics. So you're familiar with those, right? So today in our interview, we will have a quick short webinar. Today, September, is Fall Prevention Awareness Week and month. So we will discuss more on how, as a physical therapist, we can help our community. What is STEADI? What's the meaning of that? And how can we be involved in prevention of falls? All right, without further ado, Dr. Mindy, welcome. Thank you so much.
Thank you, Jenny. I'm thrilled to be here. Thank you for joining us. Thank you for taking care of our older adults and for helping prevent falls. By preventing falls, we can help people to successfully age safely where they choose to age. So it's extremely important. And I'd like to talk to you about Fall Prevention Awareness Week, how it got started. Lynn Beatty, who started this with the National Council on Aging, and what it means and where you can get lots of free resources to help you in your patients.
Yes, yes. All right. That's really good. Remember, guys, free resources. Dr. Mindy will discuss what is STEADI and just want to share that I did my free resources. It's available in CDC. Just fill out the form and they will send it to your home. We have brochures and these are all for free, 25 limits, so we can give to our patients and caregivers. So Dr. Mindy will discuss something for us about fall prevention. Go ahead, Dr. Mindy.
May I share my slides or would you like to?
Yeah, no, you can share your slides. I think you can share it. Yes. Yep, it's
All
working.
righty. Good. So getting ready for Fall Prevention Awareness Week in 2022, your time's a little short, but it doesn't really matter if your dates don't follow exactly. So feel free to do a little bit this year and a little more next year. It happens every year on the first day of fall, so that you can remember it's fall prevention. Fall Prevention Awareness Day started back in 2008 through the National Council on Aging. They started the Falls Free Initiative. And the goal of Lynn Beatty, who was a retired Army colonel, physical therapist, and educator, was to start a group in every state to have a falls free coalition group. That group could be organizations, educators, clinicians, anyone who cared about older adults. And most of the coalitions include a group of 15 to 25 active people representing usually about a dozen different organizations. In Nevada, it was run by Touro University, Nevada, in conjunction with University of Nevada, Las Vegas. Running it through universities allows you to bring students into community service and, quite frankly, provide a lot of service with supervised students at no cost. It's a win-win situation. So, Fall Prevention Awareness Week is September 19th to the 25th. And if you want to find your state's coalition, there's a link coming up. So where is my state's Falls Free Coalition, and why didn't I know this existed? And how come it's such a well-kept secret? Because marketing's expensive, and it's an organization of volunteers. That's why. But if you go to the National Council on Aging's list of state coalitions at this link by hitting Control-Click, you can look up your state and you can find out who the contact person is, get on the panel of coalition people, and or at least get on their mailing list. Most of the coalitions have a Facebook page, and you can like that Facebook page and keep abreast of what's going on. So we recommend that everybody, of course, use evidence-based outcome measures. And the best one that we have in the United States is the STEADI. And I won't tell you what that stands for because it's a little depressing, but you will see on their website what it means. The STEADI was devised based upon a few different risk screenings, and it includes a questionnaire that looks at the highest risk factors in the Stay Independent questionnaire, and 3 outcome measures. These outcome measures are things you're familiar with. They include the 30-second chair stand, the 4-stage balance test, and the timed up and go test. However, when you learn these on the STEADI training, you will see they're a tiny bit different than what we do as PTs, because they have been tested, validated, and used through anybody who works with older adults. You do not have to be a physical therapist, so they're done a little differently. They are screenings. They are not outcome measures, so they're not quite as precise. You will notice those differences, but if you are judging someone based on the STEADI, you want to do it the way the STEADI teaches it, so that it's reproducible by anybody who does the test, the screen. Okay? So it is a little different. The free provider training, which includes continuing education, which is recognized by the APTA and therefore in, I believe, 48 of the 50 states for licensure CE, is right here. Now there's 2 courses. There's provider training. That's for everybody, PTs, OTs, nurses, geriatricians, social workers. And then there's another one for pharmacists that looks heavily at medications and talks about the effects of hypertension meds and things that we know. You want to take the provider training if you want to get the continuing education credit. So there's 2 there. Make sure you select the right one. So who are the volunteers and what do they do? Well, it depends on what their background and training is. Excuse me. Any student, of course, has to be supervised by the same profession's professional. PT students must have a PT supervising them. Now, you don't need to have one-on-one supervision, but you can have one PT there overseeing 3 to 5 students. And that's perfectly okay. It's a screening. It's not be paid for treatment. It does not come under the same regulations as a PT student in your clinic. So students and volunteers might perform the fall risk screenings, which means they're going to take the online training and then you're going to train them face to face to make sure they're ready, et cetera, et cetera. They can assist with scheduling. They can help older adults learn how to use Zoom. During COVID, this was huge. We could not do face-to-face screenings. So we validated the STEADI for use virtually. And in that setting, we did the Stay Independent questionnaire, the 30-second sit to stand, and the 4-stage balance test in that order. We did not test everybody, and we did not use the tug. We felt that there were just too many variables for walking that distance and coming back safely. So we did not include the tug in the validation for virtual use of the STEADI. However, everything else was identical. We can help create gift bags for the participants. It's awesome if you want people to come back each year, which you do. They should be screened every year, to give them a great gift bag to take. And it includes the results of their screening, any information that you gave them on exercise or referral to professionals or referral to evidence-based fall prevention programs, whatever was critical. And then you throw in a few niceties. The bag that it goes in probably will have a company's logo. They might get night lights. They might get jar openers. They might get whatever you can have donated to you for using your gift bag. We'll talk about that a little bit more. But your volunteers, you'll want to start finding and setting up in the summertime. So let's say you follow the link, you take the STEADI course, you're certified, you can do the screening, you're safe, you understand it. Now what? Where do we go from there? So you'll need to present your CDC a certificate of completion before joining the final training session. This is usually for our students. They come in and we make sure they know how to use their gait belt, and they know how to explain the test, and they know how to perform the test and keep people safe. You'll learn about, and then we'll discuss the Stay Independent questionnaire. The very classic questions. Are you depressed? Are you on meds? All of those things. Do you feel dizzy? Are you afraid of falls? After completing the questionnaire, students will determine if it's safe to have the participant complete this chair stand test. And as soon as they feel they are too fatigued, they stop, and they're told that. Any participants who pass the 30-second chair stand based on their age and gender will then take the 4-stage balance test. Participants will also take the timed up and go test if they are in a face-to-face situation. And they'll be asked to complete the Steady Stay Independent questionnaire online if they prefer to not do it with you face to face. So how are we scheduled? It varies with every state, but generally speaking, volunteers are scheduled for 2 or 4 hour blocks of time when they're supervised at a facility that has not had all the volunteer slots full. In each state, there's generally 5 to 10 testing areas. So we cover the geography and we cover the cities. The final steps of the training is to do the test. So we will generally have them test each other, watch them, make sure they do it perfectly, and make sure that they don't have questions and that they have all their forms, and then they go out to the site. So what should you do now? You should go and take the STEADI provider training. Here's the link again. Be sure to take the provider, not the pharmacist training. Arrange your volunteer hours with your state's Fall Prevention Awareness Week coordinator, who you'll find through the NCOA coalition list. Mark your calendar for your training. The participant gift bags is a kind of a fun thing for everyone to meet all the volunteers and all the organizations and all the coalition members. We usually provide lunch, or at least bagels and coffee in the morning, and everyone helps fill the bags. And then everyone that's giving testing takes their 25 bags with them. Don't ask me why. But most places end up seeing about 25 participants. Now, if you're a Mayo Clinic or a Cleveland Clinic and your providers are supportive, we've had events up to 200, so they can be very large, but community events generally are 20 to 25. If you have questions, please feel free to reach out now or via email. I'd be happy to talk to you, set up a chat, set up a Zoom, and answer whatever questions I can. There's also a falls prevention group through the APTA if you're a member. If you're not, reach out to me directly. It's not a problem. I want to thank you from the bottom of my heart for getting involved in Fall Prevention Awareness Week. We have significantly decreased falls in the United States since the initiative began in 2008. We were at 42% fall rate of people over 65 in 2008. We are now at 28.5%. We have made significant progress, and we can only continue to make that better with your help. Thank you so much.
All right. Thank you so much, Dr. Mindy. This is really informative. Not everybody knows what is STEADI, which is, you said depressing, right? Which is true. It's so depressing every time we learn about STEADI stopping death, stopping elderly accidents, deaths, and injury. Imagine all negative, death, injury, accident. But the keyword is stop. We want to stop though. So that's still not so bad. So we want to be steady. We want to learn all these things. These are all wonderful resources. Dr. Mindy summarized, everyone, what do we need to do initially and why we're doing it and why we are helping. So volunteers, students are really helpful, and those that have gift bags, so we can add something. So if you have clinics, guys, of your own, this is a really nice also to help your community, and you can connect with your facility. You know, we can do assisted living, we can do community, those YMCA, we have senior help, what do you call that, like in your
The
your
senior
organization.
centers.
Yes, the senior centers. I want to say senior health. The senior centers. And then I'm in Delaware and we have a big senior centers. We can connect with a key person. So thank you so much, Dr. Mindy. I believe this will be very helpful for our colleagues. And because they're aware, I even have one friend and she asked me, Jenny, did you try it before? And then I just told her that this is what we're doing. Like, connect with CDC and we can really show this to them. At least they have a how and the different resources. So do we need, let's say, Dr. Mindy, regarding the training, is it needed to be a therapist and geriatrician? Can a normal caregivers can do this?
Yes.
Wow.
The study was devised and the training was devised specifically to hit all comers that are comfortable working with older adults.
Wow, good. Yeah, because I will be doing a educational webinar about balance and falls, and the key people are only caregivers. So I just want to be basic. So even they are not here, they can do this. The CDC.
Yes.
Oh, wow. Because they are more on base in Asia. So I will be talking with Philippines, Malaysia, Indonesia on that call, and Japan, I believe. I hope.
Awesome.
Thank you.
Awesome.
I don't know about Japan, but they're really already able to participate. They are more in dementia group, but they are want to know more about balance and fall. So we want to begin with this. Yes, yes. So that's a good thing for me. I didn't know that I can share it with the caregivers because I always think this is therapist. So thank
Well,
you.
it was interesting way back in 2009 when the expert panel sat down and they kind of locked us up for a couple of days. We had doctors, nurses, PTs, OTs, social workers, but we also
Mhm.
had senior center directors and caregivers. So
Wow.
the
Mhm.
intent of the whole thing was to make this as global as possible. Now, at first, we were aiming at primary care providers and doing it in the office. And we
Mhm.
found primary care providers did not want more time on their staff to do these. So we
Mhm.
got some response, but it was poor or it was limited.
Mhm.
So it went to the community and it had to be modified. And that's why it's screening, it's not outcome. So the
Mhm.
results are different, they look different, the cutoffs are different. It's not what we use in PT at all.
Oh, okay. Yeah, you specify that it's not an outcome measure. That's a screening. So we say, because I know that we have fall prevention screening, which is only for community dwelling people. And can we use a specific like this for our ALF people, like in some people in the facility already?
Assisted living is considered community dwelling
I
by
see.
the CDC.
Okay.
If you go to institutionalized, which is
Mm.
hospital and SNF,
Okay.
then you have to use different tests. Now,
Mm.
I will tell you that I know many community hospitals that use the study as an admission process for falls,
Mhm.
but they use different cutoffs.
Okay.
So
So I
it
see.
it is used, but it's modified a bit.
Yeah, I think the one that you say when you say institutionalized, I have difficulty. And hospital based, I have another one from CDC, like the inpatient program. Do you think is this the one that they use, Dr. Mindy? Ah, okay. Best
That's
practice.
for discharge. So that's
Mhm.
for
Oh,
someone who's leaving the institution and going home. And so it's
okay.
pretty much the same as the study, except that it asks more about the home.
Okay, for preparation going back home. And the
Right,
one in the hospital will be more on they need to have a fall expert, something like that. And they have a program. I think that's why you say some a little bit different. Yeah,
right.
so Ah, okay. Yeah. So it's really good to know because our colleagues are acute based, which is hospital based. So that will be more onto them. I am home health. So I am more on the ALF and the people home in their home. And we have purely SNF. They are only in the SNF. Of course, our outpatient therapies are a lot and very able for these things. So thank you so much, Dr. Mindy.
You're
Um,
very
we
welcome. You
we appreciate
take
you so
care.
much. Mm-hmm.
And please let me know when you're talking to other countries. I'd love to be a fly on the wall and just listen.
Yes, sure. We will going to invite you as our key person too, you know. Thank you
I
so
don't
much.
mean to speak or steal your thunder. I
No,
would just love to hear it.
yes, yes, of course. We will invite you definitely. It's really nice to see everybody from different places, you know. I spoke with in Indonesia at one time. They're so shy to talk because they said, "All right, we're speaking in English," they told me. Dr. Jenny should speak in Indonesian language. They tease me like that. So it's really nice, different cultures. So thank you so much again, Dr. Mindy.
Thank,
Thank you so much, guys. Again, if
thank
you have
you.
any questions for Dr. Mindy, she is available in our email and we will post it there. And we appreciate you. And if you have any questions, connect with us as well. All right. Thank you, guys. Thank you,
Thank
Dr. Mindy,
you.
and God bless. All right.
Bye-bye.
Bye.